It's spring and everything is fresh and new outside. Maybe you need a little rejuvenation too. Today's Fresh Look, sponsored by Becky Munson Skincare. Becky Munson Skincare offers acne scar treatments, laser hair removal, skin tightening and rejuvenation. They also have some physician-assisted services. And joining me to talk a little bit more about those is Dr. Gutowski, board-certified plastic surgeon. It's good to have you.
Thanks, Matt. Great to be here.
Tell me a little bit about some of the services that you offer folks.
Sure. I'm a board-certified plastic surgeon. I do the full range of plastic surgery services, everything from facelifts, eyelid procedures, tummy tucks, liposuction, and I have some innovative procedures such as breast enhancements using a patient's own natural fat so they don't have to get implants. Wow. But one thing that I'm very proud of that we get to do here are non-surgical treatments, things like injections, Botox. We can do laser services, and I can even do neck skin tightening with a laser. So a lot of different non-surgical products we can do.
And so you consult with people who come in, they say, hey, I'm concerned about X, and you make recommendations based on the things that they are most concerned about.
Absolutely. I take each patient into account individually and come up with a treatment plan for them that typically involves Becky's services also.
Okay, so tell me a little bit about Julie.
Okay, well, Julie looks great, and we've known each other for a while, but as all people age, they lose a little bit of fullness in their cheeks. And so what we're going to help her with today is she's got great cheekbones, but she's got a little bit of a hollowness here and here, which can sometimes make people look gaunt or a little bit older. I'm going to use a product called Bellafill. It's classified as a filler, but it's really a collagen stimulator. It helps your own body make collagen, and it lasts a long time. Most products last 6, 9, maybe 12 months. This one, at 5 years, 90% of people still see an improvement. So you don't have to keep coming back once or twice a year to do this. You do it once, and then we don't see you again for a few years.
And that's amazing that it actually stimulates what your body already wants to do. It's just helping it along.
Yes, it does. Yes, it does.
I like that. Okay, so model for me when someone comes in and has a consultation. Do with Julie what you would do for someone who's in our viewing audience who might come in.
The first thing is, obviously, as a physician, I get a history and physical. I look over any kind of medical issues they may have, make sure they're appropriate for this. Then I do a comprehensive facial analysis, because sometimes people may notice one thing, but as a board-certified plastic surgeon, I'm trained to look at the whole face and address issues. You don't want to just fix one thing if other things don't look right. So we'll look at lines. Botox can be used to treat lines with movement. Very common procedure, just takes a few minutes. We may look at fillers. We may look at loose skin. So let's say she doesn't, but let's say Julie had a lot of loose skin hanging here. We could talk about a surgical treatment. If it's a little bit of loose skin, we can talk about one of our laser treatments. There's a whole range. I'll present a range of options, and then I'll give my recommendations and even a sequence of how to do them and in what order.
And so in this particular case, as you mentioned, we're going to look at kind of that hollowness that comes in as we all age.
Yes.
That's a natural process. And so tell me a little bit about what you talked with Julie about in terms of that.
Sure. So I discussed the different options for her, and I told her this is going to be a very subtle improvement because we don't want to make her look unnatural. We want to kind of ease into this. So the treatment is going to be an injection right in through here and a little bit up into here to give her cheeks back. She's got the cheekbones, but she's got the hollowness here. It's going to be an injection. I've already numbed her up, so she's not going to feel very much from this. I've cleaned her skin, so her skin is ready for it. And I'm going to use something a little different, not a needle, but something called a blunt cannula, which instead of a sharp tip on it, has a little rounded tip, and it causes very minimal bruising because it doesn't cut. It just kind of pushes through the tissue. So she may feel a little bit of movement under there, but it typically doesn't hurt, and people can walk out of here, go back to work right away.
Well, I'm going to let you get set up real quick and then ask you real quickly, you are a board-certified plastic surgeon, but you actually train plastic surgeons.
I do. I publish a lot. I teach courses. I've taught injection courses like this to plastic surgeons. So I'm always kind of ahead of the curve. I've been using this product, which most people don't even know about, for probably about 10 years.
Wow.
And it's just kind of one of those things that I use all boards or all FDA-approved products for my patients because I want them really to have the best results possible.
Yeah, you come down to Champaign, it's nice to have those services available.
I'm glad to be here.
Yeah.
All right, so we'll get started in just a little bit. I'm going to have you turn your head this way. And she's already numbed up, so are you feeling anything?
No.
Good. You're going to feel a little bit of popping here.
So, Julie, you're feeling the physicality of that, right? But you're not feeling any pain?
No pain.
Okay, so the nerves are not feeling anything, which has got to be a huge relief in a situation like that, yeah.
So I'm depositing this product in tiny little micro droplets so that the body can start making collagen. And so it's quite a few passes. This can take a few minutes per syringe. But I want it all spread out. This isn't just like one big injection. And that's the beauty of this, is it helps the body make its own collagen over a period of time. You do see results right away because there's a little bit of collagen in this, but it gets replaced by your own body's collagen.
And you told me something that's really interesting, that it's not a needle per se, because that's what causes the bruising.
Exactly.
But there's no bruising here.
There's very unlikely to have any bruising because there's no sharp tip, and the product comes out the side of this tube called a cannula. And you can see I'm moving it in there, but I'm not cutting through anything. Yeah. And so she's really not going to bruise.
Wow, that's amazing.
Okay. I don't know if you guys can see this, but she's now got fullness there, which she didn't have before. And this is just from one syringe. And she can walk out of here looking pretty much, normal, but with just a little bit more fullness in her cheeks now.
Yeah, okay. It's a very slight mark, and I'm sure that heals very quickly.
Yeah, by tomorrow, no one's even going to know that was there.
Yeah, how great is that? Good, you feel good?
I feel great.
Good, okay, that's great. Dr. Gutowski, thank you so much.
Great, thanks for being here.
This is definitely something we haven't ever done on CI Living before, so seeing this happen firsthand right here on the show is very cool. Now, we'll connect you to Becky Munson Skincare. They have a website, BeckyMunsonSkincare.com, where you can set up appointments, learn more about the services that they offer, and they'll have the phone number on there, too. We'll connect you there at CILiving.tv, and while you're there, give Becky a like on Facebook.